Today, we are discussing a topic that is both intriguing and a little worrisome, particularly for those who have been prescribed metformin for a long time. Yes, we are answering the question, what happens if you take metformin for more than 5 years? The problem is that the longer you are taking a medication like metformin, the more crucial it is to stop and consider whether it is still working for you and whether you are noticing any changes in your body. Sometimes, even minor symptoms can indicate more serious problems that can be completely avoided with a quick checkup and a few adjustments. Before we get started, I just want to clarify that it is generally safe and effective. However, there are risks associated with any long-term drug, and believe me, some of the things I'm going to discuss or share today may inspire you to call and arrange for your next blood test or begin making some positive adjustments in your life. I'll provide some excellent advice. Okay. Let's begin with a major one. Over time, metformin may hinder your body's absorption of vitamin B12, which is a serious problem because vitamin B12 is essential for nerve function, the synthesis of red blood cells, and your general energy levels. Consider adding a B12 supplement to your routine if you've been feeling drained, hazy, or even tingly or numb in your hands and feet lately. A good option is taking 5,000 micrograms a few times a week, especially in solution form for better absorption. These liquid supplements are simple to use and can help maintain healthy B12 levels, supporting your energy levels, nerve health, and general well-being. Nowadays, whether you are taking B12 supplements or are starting a new supplement, you should always check with your supplier to make sure your B12 level is not already elevated. So, what implications does this have for diabetes? Let's explore that. But first, a big thank you to those of you who've stuck with us this far. Creating these videos takes significant effort and dedication, so if you're enjoying the content, please hit the like button, subscribe to our channel, and share your thoughts on diabetes in the comments. Your support truly helps us grow. Now, let's get back to the video. Next up, kidney health. Before we continue, I'll say that taking metformin for years necessitates routine monitoring of your kidney function. This is because the medication is excreted through the kidneys, and if they're not functioning properly, it can accumulate in your system and cause lactic acidosis, a rare but serious condition. Additionally, some studies suggest that prolonged use of metformin may directly affect kidney health, raising concerns about potential damage over time. To support your kidneys while taking metformin, think about adding certain supplements to your regimen, such as probiotics, which have a daily intake of 100 billion probiotics. It can boost your general metabolic health and help keep your gut healthy. It can be found in food or supplements. It can boost your general metabolic health and help keep your gut healthy. It can be found in food or supplements. Your kidneys may benefit greatly from the antioxidant effects of adding alpha-lipoic acid, for instance, at least 600 mg daily, or 300 mg of benfotiamine, which can help shield your kidneys from oxidative stress. Last but not least, a high-quality B-complex vitamin can help your cells stay healthy and produce more energy, so it's a complete strategy to keep your kidneys healthy. Something that may not be on your mind right now, although it's less common, there have been reports that long-term metformin use may actually stress the liver in some people. If you already have liver problems or drink a lot, it's important to discuss this with your doctor as soon as possible. One natural method that may help your liver health is milk. Generally, we advise consuming approximately 1,000 milligrams of milk. This herbal supplement's primary ingredient, silymarin, has been used for generations to protect and cleanse the liver. Silymarin is thought to possess anti-inflammatory and antioxidant properties. Our research indicates that the substance will lessen liver stress and encourage liver cell regeneration. Another problem that actually relates to the vitamin B12 deficiency we discussed earlier is peripheral neuropathy. Long-term metformin use may make people with diabetes worse off with nerve problems. That's double trouble, right? Imagine having pins and needles in your feet every day. That's not fun and definitely worth keeping an eye on to support your nerves. Regaining health in your daily routine, alpha-lipoic acid and benfotiamine can be used with vitamin B12 and L-carnitine for a synergistic impact that helps reduce nerve pain and preserve nerve function. Check your feet frequently, at least a few times a week, to make sure there are no lesions, because when you have neuropathy, you may develop lesions or ulcers that can progress quickly and lead to amputation, which is not what we want to see. Another thing that catches people off guard is gastrointestinal symptoms, which can appear in the early days of taking metformin but can also occur years later. If you're in excessive pain, you may occasionally need medication, so it's always important to speak with your doctor. Because occasionally individuals will say, "Hey doctor, I have diarrhea, and I'm not sure what it's from." When I mention that I've been taking metformin for years, they say, "Oh, that's a problem, right? You have been on this for years." Sometimes it appears later, and now we're even discussing nausea. Stomach discomfort and diarrhea. Early symptoms may appear gradually, but persistent late-onset diarrhea might strike suddenly after years of use, drastically affecting your quality of life and leaving no one to question whether you are taking metformin or not. However, if you are experiencing any of these problems, including persistent diarrhea, your doctor may suggest that you switch to extended-release metformin. If that is what you want to do, I tell my patients that, although there are other supplements available, such as herbal remedies like berberine and dihydroberberine, if you are looking for a free metformin, extended-release metformin might be a better option to at least stop the diarrhea, but you want to speak with someone who is knowledgeable about holistic medicines. There are a number of less common side effects that some people may experience, such as headache, muscle pain, lightheadedness, unusual sweating, taste changes, and even a rash. Although these side effects are rare, they can still happen to some people, so if you have been dismissing any of these symptoms as normal, it might be worth considering. If you simply bring the berberine to your allopathic doctor, who has never heard of these wonderful herbs and supplements, they may be shocked and may completely deny it. If any of these symptoms seem familiar to you, it's a good idea to talk to your doctor about what's happening and look into other options. For instance, lightheadedness may make daily tasks more difficult, especially as you get older. Taste changes may also be subtly affecting your appetite attack, making it difficult to understand why you're losing so much weight. After a certain age, some type 2 diabetics complain that they're losing too much weight. Of course, this will also affect how much they enjoy their food. And once more, it's crucial to remember that you should never stop taking metformin suddenly without first talking to your doctor unless you are closely monitoring your blood sugar levels and you know what you're doing. However, when you are thinking about switching to a natural supplement like berberine, which has shown promise and a lot of evidence for helping your blood sugar levels, you can do it yourself if you're confident, but it's best to get advice from your holistic functional medicine provider. You can also talk about reducing the dosage of metformin and adding, for instance, berberine or dihydroberberine. If you're wondering what dihydroberberine is, it's a more bioavailable form of berberine that may help lessen some of the gastrointestinal side effects linked to metformin. In fact, dihydroberberine has a lot fewer side effects than berberine. Consequently, metformin has the most adverse consequences. In fact, the combination of metformin plus either berberine or dihydroberberine has holistic effects because berberine has less adverse effects and dihydroberberine has virtually no side effects. Sometimes, you can get the best of both worlds by lowering your metformin dosage and adding berberine or dihydroberberine. Studies have even examined the use of metformin and berberine together, and the results have been excellent. Before you freak out, know that this may sound like a lot, but you don't have to face this alone again. Consult your doctor. Watch our videos to learn how to safeguard your liver and kidneys and steer clear of any negative effects that could interfere with your medication and make your body more balanced. Therefore, metformin is still a popular option, and I believe it will continue to be so, but before you watch this video in which I discuss dihydroberberine, it's crucial to understand your options and potential alternative therapies. I'll see you there.